Hi, I'm Dr. Nan Boss. This puppy is Isa. She's about 5 months old, and obviously she's a German Shepherd. German Shepherds have genetic risk for some serious problems that I'm going to need to talk to the owner about. Isa's owner was nice enough to drop her off on the way to work this morning, so Dr. Hinz is here to help me with Isa because she's a wiggly girl. So the two most prominent diseases that we can DNA test for in German Shepherds are von Willebrand's disease and degenerative myelopathy. So von Willebrand's disease was discovered by a physician in Finland about 100 years ago. His name was Erik von Willebrand, and so the disease is named after him. He discovered that there are various, they call them factors in the blood. They're actually proteins in the blood that are part of a cascade that helps the blood to clot when there's an injury. So the genetic problem that German Shepherds have is they don't always make von Willebrand's factor, and so then their blood does not clot right. They develop hemophilia, which is the technical name for an abnormal bleeding problem. They can bleed to death from a simple surgery or a laceration or some kind of wound. They bruise very easily. It can be a fatal disease. The other disease that can be DNA tested for that Shepherds are very prone to, German Shepherds and Corgis, is degenerative myelopathy. This is a syndrome that's similar to Lou Gehrig's disease in people. So it's a neuromuscular disorder. It starts with weakness in the back legs and it gradually works its way up the body until you get pretty complete paralysis. Obviously not a disease you want your dog to have. So ideally, when you are going to purchase a German Shepherd puppy, the breeder will have tested both parent dogs so that they know whether those dogs are carrying either of those diseases so they can avoid breeding a dog that's positive. Isa here came from a rescue, so we do not know what her parentage is. We don't know if her dam and sire were tested for von Willebrand's and degenerative myelopathy. So we're going to go ahead and do her DNA test. She's kind of wiggly, as you can see. The DNA test that we want to do uses a brush swab that we have to roll around in the mouth for a while. We're going to wait until we have her under anesthesia to spay her before we do that test, just because we think she's going to be a little bit difficult to hold still to do that. But then we will know for sure whether we have an issue with bleeding. The other problem that we will look into when we spay her is hip dysplasia. Most people have heard about that. So that's when the hips don't develop properly. You have too shallow a hip socket and you develop arthritis very quickly if you have that problem. I actually have hip dysplasia myself. I had to wear a brace when I was a baby. So people can get that too. In dogs, it's not so simple as doing a DNA test for hip dysplasia. There's more than 40 genes that are involved in the formation of the hips. There's also influences with exercise and diet. So I had a client years ago who started running 4 miles a day with his 4-month-old German Shepherd puppy, and all that pounding on the pavement caused a lot of havoc in that puppy's joints. So I always talk to people about not overdoing it on hard surfaces. There was actually a study done a few years ago that corroborated that. They found that puppies raised in the winter when the ground is hard have more problems with hip dysplasia than puppies raised in the summer when the ground is soft. We try to prevent all the large breed dogs from growing too quickly, so we monitor their weight pretty carefully. If they grow too fast, their bones can't quite keep up with them, and they end up with cartilage disorders in their shoulders and elbows and knees, and they also are going to have more of a problem with their hips. So when we spay Isa, we will x-ray her hips and see what they look like. If she does have some serious hip dysplasia problem, then we can go ahead and proactively start medication. We'll know what to be looking for. I don't think she's going to be bad enough she would need surgery right away for that, since she's not lame. But that's a common problem that we will investigate when we have them under anesthesia. Another genetic problem of German Shepherds is bloat. So the technical name for that is gastric dilatation volvulus, or GDV. So what happens is the stomach fills up with air, it twists over on itself, which shuts off its blood supply, and then the stomach is basically dying because it doesn't have enough blood supply. The stomach continuously produces stomach juice and gas, and so all that gas and fluid have no place to go once the stomach is twisted. This condition can be deadly within a couple of hours. It's unfortunately a very expensive surgery to repair it at the emergency clinic. It is better when we spay them to do what we call a stomach tack. So we go in and we fasten the stomach to the side of the body wall so it can't flip on itself. So when we go to spay or neuter, that will be a choice that we will give the client, whether to do that stomach tacking procedure in addition to the neuter surgery. We are also recommending spaying and neutering at much later ages than we used to. So the recommendation was always that we would spay or neuter at about 6 months of age. Especially with the spay, the goal was to not let the female dog go into heat. Each heat cycle they go through increases their risk for mammary cancer later in life or breast cancer. So our goal was to spay before they ever went into heat. But all of that is kind of flipped on its head now because the studies show that you will have less risk for hip dysplasia and torn cruciate ligaments in the breeds that are prone to that if we wait until the dog is a year of age or older before we spay or neuter. Isa, because she came from a rescue, their primary goal is to reduce pet overpopulation, and so they require spay and neuter almost immediately after a client gets the dog. A lot of the shelters spay or neuter before the puppy ever leaves the shelter. However, for the individual puppy, that's not a good thing. That's going to increase their risk for joint problems later. So our goal on an individual patient basis is to wait and to spay or neuter later. So I typed up a letter for the owner to send to the rescue asking if we could delay the spay until Isa is at least a year old. And another one of the clients that adopted one of Isa's litter mates was also concerned about the same thing, and so we're hoping that we can change the protocol of the rescue a little bit. So again, our goal is the best possible care for each individual pet, not so much population control. Things that the client will have to worry about with their German Shepherd as they get older. Shepherds are very prone to ear infections. Most of the time we expect our otitis dogs to be the ones with hanging down ears. It's always dark and damp in the ear canal, but Shepherds, even with their upright ears, have some tendency toward ear infections. They also are prone to allergies, as a lot of breeds are. German Shepherds are more prone than the average breed to develop food allergies. That's a genetic condition too. In fact, all allergies have a genetic component. Again, complex genetics, not something you can do a single DNA test for that's going to be either positive or negative. But we will see food allergy. Digestive disorders are fairly common in German Shepherds. They can be kind of a challenge sometimes with all their various health problems. They also are prone to some specific types of cancer when they get older. So one of the main cancers that we worry about with all large breed dogs when they get older is hemangiosarcoma. That's a cancer that develops out of blood vessels. We tend to see it most commonly in the spleen. German Shepherds are actually more prone to get hemangiosarcoma on their heart. So they'll have a tumor in their heart. It will start bleeding into the sac that holds the heart in place inside the chest, or it can rupture. It can cause a lot of pressure if there's bleeding around the heart, and they can have some sudden heart disease symptoms. So that's something for the owners to be very aware of once she gets older. We do have another video on our website and our YouTube channel about hemangiosarcoma. We also have one on bloat. So if you're interested in those things, I believe there's also an arthritis and hip dysplasia video too. So these are such common problems, not just for German Shepherds, that we have done several videos on some of these things that Isa here is going to be prone to. Anything else I'm missing?
No, I think that sounded great.
All right, so those are the major problems with German Shepherds health-wise. So shop carefully if you're thinking about getting a puppy so you can minimize your risks, and think about what all you might want to do for not only genetic testing but for x-rays and surgery in order to prevent problems down the road. Thanks.